My name is Chughtai. I'm a urologist who practices in the Plainview area. I specialize in functional urology and enlarged prostate. So when it comes to patients' goals, I think it's important to ask the question. There's some patients that you'll see and their goal is, I want to not be on long-term medications. Other patients will tell you, look, I've had this episode of felt like retention. I want to make sure that never happens again. Other patients will have bothersome urgency, frequency. So I think it's important to have that conversation, what they're trying to accomplish. So that's the way I sort of approach it, asking the patient what they're trying to achieve with the given therapy so that we sort of have our goals aligned. When it comes to patients with BPH and selecting out who does well with which therapy, specifically when we focus in on to Optilume, I find patients who are looking for preservation for sexual function, specifically ejaculatory function, and those who are really looking for a long-term durable outcome and are able to tolerate a catheter for a couple of days. I think where Optilume really shines is when you look at its functional outcome, it's got one of the highest Qmaxes we've seen for any minimally invasive therapy. In addition to that, I've always been surprised, but when we take that catheter out, the results and the reaction from the patients being like, whoa, I've never seen a flow like this before. It's pretty incredible. And I think for a minimally invasive therapy to be able to give you ejaculatory sparing, right? In other words, no change in ejaculation, and give you this very durable and improved Qmax is pretty incredible. So when it comes to patients deciding between BPH therapies, I think there's a slew of factors that become really important. I think one is the rate at which you're able to urinate, so also known as flow rate, in addition to what's left over in the bladder. So I think when it comes to Optilume for BPH, it gives you an incredibly good functional outcome in terms of how well you're able to urinate. I think Optilume also checks the box when it comes to a very strong safety profile in terms of very low rates of complications, as well as very good preservation of sexual function. So when you're talking about a therapy that checks a lot of boxes for a lot of patients, Optilume really does fit that bill.